Hello, welcome to Dear Dr. Mao, every Mondays at 5 p.m. Pacific Standard Time. Today's topic is Tame sleep apnea with tongue exercises. Do you or know someone who snores while sleeping? Do you consistently feel tired and not well rested even after 8 hours of sleep at night? Do you find that you're losing focus and not remembering as well at work? If you answered yes to any of the above questions, you may have sleep apnea and should get a test to find out. Sleep disorders due to sleep apnea has become a serious health issue in the United States, well, actually, the rest of the world too. It has been estimated that 22 million Americans suffer from sleep apnea, with about 16 million of the cases of apnea undiagnosed. Most sufferers of sleep apnea snore when they sleep and tend to be overweight, wake up tired, feel moody, and have trouble focusing during the day due to lack of sufficient deep and restorative sleep. So what is sleep apnea? Sleep apnea is a condition when you stop breathing during sleep and then you're suddenly jolted awake, gasping for air by your body trying to get you to breathe again. Most of the time, you're not aware of it happening. It is most commonly caused by obstructive sleep apnea, or OSA, which is due to mechanical and structural malfunctioning that leads to blockage of the airway. It occurs when the soft palate at the top and back of the mouth and throat collapse and combine with your tongue falling back, closing the airway during sleep. The reality is that it is an aging problem, although it can happen in children and young adults with chronic allergies, sinus, and throat problems. But most of the time, obstructive sleep apnea is a phenomenon of aging, where the muscles of the mouth and throat weakens as you get older, meaning gravity is causing your muscles to fall down, including your face, unfortunately. Now, a less common type of sleep apnea is the central sleep apnea, and is due to a failure of the brain to signal the throat muscles to breathe. That's more rare, though. Sleep apnea can be deadly and can contribute to serious chronic diseases and affect your longevity. Studies have shown an association between sleep apnea and type 2 diabetes, heart attack, hypertension, stroke, and even a shortened lifespan. One condition that is adversely affected by the lack of oxygen from sleep apnea is cancer. Cancer appears to feed off oxygen deprivation or hypoxia. Studies show that hypoxia definitively contributes to aggressiveness, resistance to treatment, and metastatic dissemination of cancer. You see, when hypoxia occurs, the body throws off free radicals and increases tissue inflammation. During this, cancer cells actively seek oxygen and energy by forming new blood vessels and invading surrounding tissues. Researchers have found that intermittent hypoxia is one of the causes of metastasis in triple-negative breast cancer. For men, it is also implicated in metastatic prostate cancer, which is the second leading cause of cancer-related deaths. So what are your treatment options? In Western medicine, there's always surgery, where surgeons go in and remove excess tissue from the soft palate and pharynx. This is called, uvulopalatopharyngoplasty, or I like the abbreviated version, UPPP. The tonsils are also removed if you still have them. Why not, since the doctor's in there already? Other procedures involve sinus surgery, soft palate implant, and tongue base reduction. Having said that, surgery is probably the last option. Now, non-surgical options include, I'm sure many of you are familiar with this breathing machine called CPAP. It is part of a treatment called positive airway pressure, or PAP therapy. CPAP stands for continuous positive airway pressure therapy. A CPAP machine uses a hose and mask or nose piece to deliver constant and steady air pressure. There are two other types of PAP machines, APAP, or automatic positive airway pressure, that adjusts automatically to meet your individual changing sleep stages and breathing needs, and VPAP, or variable machines, that use two different pressures, one for inhalation and the other for exhalation. These machines got some press recently with hospitals running out of ventilators that some were adapting the VPAP for COVID patients. Common problems with PAP machines include a leaky mask, trouble falling asleep, stuffy nose, and a dry mouth. In other words, it's not very comfortable, and you might agree, also not very sexy, causing many patients to remove their CPAP device at night. There's also another option, using dental appliances. A custom dental appliance built by dentists specialized in sleep medicine is prescribed for patients to wear at night to keep their lower jaws and chin forward and tongue depressed in order to keep the airways open. Some patients have expressed positive benefits with this, although TMJ or temporal mandibular joint disorders have been reported by some users of these dental splints. Now, I would like to share with you how Chinese medicine treats sleep apnea. By the way, sleep apnea is not a new problem and was recognized and recorded as far back as 5,000 years ago in the Yellow Emperor's classic on medicine. It was determined to be a syndrome related to digestive, respiratory, and kidney functional decline. So at Dial of Wellness, what do we do for our sleep apnea patients? Here are 4 things we recommend. First, diet and nutrition. Certain foods have been determined to provoke production of mucus, which may cause obstructions in the sinus passage and throat airways, interfering with proper and healthy breathing. These foods tend to contain either high levels or provoke the body to produce histamine, and include all fermented foods like alcohol, cheese, bread, yogurt, cured meats, pickled, vinegar, etc. Ask your Dial Wellness practitioner for a complete list of foods to avoid in order to reduce your histamine and therefore mucus in your body. Second, acupuncture. Clinically, we have found acupuncture to be effective to affect muscle functions, including improving tone while relaxing tight muscles. In sleep apnea, acupuncture along with electrostimulation have been used successfully to strengthen muscles of the soft palate, tongue, and throat while opening airways in the sinus and trachea. A pleasant side effect, reducing your double or triple chin and lifting your jawline. Third, tongue exercise. Whenever I suggest this to my patients, I get a strange stare and an accompanying grunt. My tongue? Yes, your tongue. There's a saying in Chinese, diseases enter through the mouth and troubles emerge from a loose tongue. In sleep apnea, yep, a loose tongue is a huge liability. In fact, when the ceiling of your mouth is collapsing already and when your loose tongue falls back, it's the perfect storm. Complete obstruction. Here, I'm going to share with you 3 simple tongue exercises. These exercises are designed to strengthen all the muscles in your throat, mouth, and tongue in order to lift the soft palate up, make your tongue firmer, and the airway opening bigger. Are you ready? First, turn your head back to look up, stick the tongue out, and try to touch your nose. Hold it for 10 seconds. Swallow at least once during the tongue hold. Whoa. Repeat 5 times. All right. Second one. Again, turn your head back to look up. Stick your tongue out and try to touch your chin. And hold it for 10 seconds. Swallowing again at least once during the tongue hold. Wow. Repeat 5 times. It's not as easy as it looks. But keep working on it. Third one. Tug your chin against your chest. Suck and retract your tongue backwards against the upper palate. Hold for 10 seconds and swallowing at least once during your tongue hold. Whoa. Repeat 5 times. The 4th treatment technique in Chinese medicine for sleep apnea is the 6 healing sounds meditation. What is the 6 healing sounds? The ancient Taoist tradition gave the world Chinese medicine, binary language underlying modern computing, and feng shui, among many other arts and sciences. And they also passed down the 6 healing sounds meditation for health and healing. Each sound corresponds and balances an organ system. Each of these sounds engage different muscles of your throat, mouth, and tongue. What's amazing is that as you practice these healing sounds and experience their benefits in your tongue, throat, and abdominal core areas, you may think that the 6 healing sounds were designed by ancient Taoist physicians specifically to prevent sleep apnea thousands of years ago. Pretty amazing, huh? I highly encourage that you practice the 6 healing sounds by going to taostar.com and download the instructional program. It is a powerful self-healing meditation for other health conditions too. In conclusion, if you want to improve your sleep apnea naturally, I encourage you to try our program and the practices that I shared with you today to specifically fight gravity and improve your muscle tone where it matters, and ultimately slow down and reverse your aging. Be sure to tune in Thursday for the newly weekly Tao Wellness COVID update. Until then, live long, live strong, and live happy.